And you cannot have core strength unless the muscles are close together. Period. End of story. So if people are doing planks in an abdominal facing down position, that's stretching the connective tissue. Okay, so that if you have a diastasis, so any abdominal facing down, so instead of doing it this way, we'll do those exercises standing. We modify.
All right, everyone. Welcome back to the Dr. Alex Show. And this episode is going to be pretty cool because I had someone reach out about a condition that, as chiropractors, is very important to understand. And I'm excited to learn about it. Particularly, we're going to learn about diastasis. And chances are, if you don't have it, I'm going to assume you know someone that's going to have it. And it's going to be really funny because now everyone's going to be checking themselves after our lovely guest here, Julie Tupler, registered nurse, certified personal trainer, and childbirth educator, is going to discuss this today. And I'm going to let Julie take the floor here in a sec and go over things, but this will be a very good topic for people who are postpartum, people that are a little out of shape, and people with low back pain. So, Julie, thanks for coming on the show.
Thank you so much for inviting me because diastasis recti, which is a separation of the abdominal muscles, is a condition that most people have, but just don't know they have it because they're not normally checked by their medical or fitness professionals. And as I told you earlier, I'm hoping before I leave this planet that that's something that happens, that every belly gets checked for a diastasis as part of any medical or fitness evaluation. Um,
And now, sorry, how long have you been doing this?
I've been treating diastasis for 30 years now. I started my business in 1990, and it was maternal fitness, and it was preparing women for the marathon of labor. If you're running in a race, you train. Why wouldn't a woman do the hardest thing she's ever going to do, labor, and not train for it? So, what I discovered in working with pregnant women was this separation of the abdominal muscles. And when I did research on it, there was really nothing, no treatment for it, but just a definition that the muscles are separated. So, it's been a learning process for me through the years. And what I've discovered is that in my research is that everybody is born with the diastasis, and normally the muscles get closer together around 3 years old after the nervous system is developed. However, because there's a weak spot at the umbilicus or your belly button, if you put force or pressure on that weak spot, they open up again. The muscles will separate. So during childhood, if the child is continuously crying, constipated, and then in early childhood, if they're doing gymnastics where they're arching the back, which is stretching the connective tissue, crunches, abdominal surgery, the pregnancy or the beer bellies, any type of, a car accident, all these things. Actually, 37% of my clients are men over 50. So that's people always think that diastasis is always for women that have been pregnant, and that have, had a baby, but it's not only pregnant women. It is pregnant women for sure, all right, that have this separation. And with each pregnancy, this separation gets bigger, and that is why women show faster because of this.
Sure.
So during pregnancy, it's really important to do my program and make that diastasis smaller because it affects the type of birth they're going to have and it affects the way they push. So, in terms of the type of birth, if the muscles are separated, right, a lot, and this is my uterus here, and this is my cervix, it needs to be lined up with the vaginal canal. When the muscles are separated a lot, there's no support because the connective tissue between the separated muscles is stretching sideways, so there's no support. So the top of the uterus tilts forward. So now the cervix is pointing sideways instead of downwards, which is a C-section ready to happen. So having a large diastasis does put a pregnant woman at risk for an unnecessary C-section. The other thing is with the pushing. When the muscles are separated, they move like 4 fingers apart or more, they move side to side. Now, in pushing, the muscles need to move front to back in the sagittal plane of movement to compress the uterus. If they're moving side to side, that's not helping with the pushing. All
Sure.
right, so the muscles have to be close together to move. So, with my program, having a smaller diastasis, the muscles are going to move in the right direction. We also teach women how to push with their strengthen. If this is my uterus and this is my abdominal muscles, how to push with their abdominals while relaxing the pelvic floor. So this is a skill that the childbirth educators do not teach. And this is a skill that needs to be practiced during pregnancy so it becomes second nature during labor. So when a woman is having a bowel movement, she needs to use her abdominals and relax the pelvic floor so she understands that she doesn't want to tighten the abdominals, tighten the pelvic floor. Sort of like squeezing toothpaste out of a tube, taking the cap off.
Yeah.
So, so, so that is where it started for me. And my aha moment with treating this condition was with a patient that we were doing these abdominal exercises for the innermost abdominal muscle, the transverse muscle, which is attached to the outermost rectus abdominis muscle. And that's why it's called diastasis recti, because those outermost abdominal, those recti muscles are separated. So she had a huge diastasis. When she would come up, you would see this alien-like or half football-like bulge, this doming of her, which is actually the organs moving forward, because there's just like a piece of like saran wrap over your organs.
Sure.
Okay.
Almost,
So
almost like a hernia.
yes, it presents like a hernia, but it's not a hernia. All
Sure.
right. But people, when they see this bulge, they think that they have a hernia. So we're doing the exercise, and she said, "Julie, I don't feel my muscles working." So I took a scarf and I manually brought the two halves of the muscle together, and then we did the exercises. And she said, "Oh my God, I feel my muscles working." So that was an aha moment for me. I realized that I needed to reposition the muscles and the connective tissue. So my program is all about strengthening that weakened and stretched out connective tissue between the separated muscles. All right. That's the big picture. We want to strengthen it so it's strong enough, this connective tissue, to hold the muscles in a close together position. Okay. And there's the big picture. All right. We want to reposition the muscles and the connective tissue like I did with this woman, but I have this splint that I've developed to approximate or bring together. So we want the muscles in a close together position. So as I said, they move front to back instead of side to side.
Sure.
So when they're doing the exercises, they want them moving front to back. And because you use your abdominals with every move you make and with every breath you take, it's important that they be in this close together position. So when they sneeze, they can bring the abdominals back. When they cough, when they stand up, when they sit. So with all activities of daily living, we're wanting to develop an awareness of how to use the abdominals in a backward direction. All right. Because if it goes in a forwards direction, it's stretching the connective tissue. And if we're stretching the connective tissue that's already stretched out, we're not going to be able to strengthen it. All right. So we want to keep the muscles in a close together position. We want to keep the connective tissue. We want to put it in a narrow position. It's almost like when you wear a cast and you to keep the two ends of the broken bone together so you continuously keep it there so it fuses eventually. Well, it's the same thing with the connective tissue. We want to take the stretch off it and put it in a narrow position and continuously keep it in that position. So that's the position that it's in with every movement of the abdominals so it doesn't get stretched. Okay, this is the best position for it to be continuously. So that's why we, as part of the program, have you wear the splint, all the time, even when you're sleeping, just like you would wear a cast when you were sleeping. You take it off 15 minutes to bathe and then, put it back on. So repositioning is the first way to strengthen the connective tissue. Doing the seated exercises, all right, which work the transverse and the recti. All right, we actually have two seated and one back lying exercise. And then developing the awareness of using this innermost transverse muscle to prevent the connective tissue from getting stretched. Okay, if we're strengthening it, we don't want it to get stretched, either in a forwards direction or a sideways direction. So that's the big picture. My program is research and evidence-based. The research is from Columbia University Program in Physical Therapy. When I first was doing the program called Maternal Fitness, one of the physical therapists that was teaching the program said to me, "Oh my God," because we would check everybody in week 1 and week 6 for the diastasis during the pregnancy. And during the pregnancy, as their bellies were getting bigger, the diastasis was getting smaller by doing my program. So she said, "Oh, you need to go to Columbia." And so they did that research study, and that the original research study, there's a link that you can read, is on my website. And it showed that basically, you can make the diastasis smaller during pregnancy, which is, again, really important for the pushing and to prevent a C-section. So my program is also evidence-based. So with 372 clients, and this is all on my website as well, the statistics, with 372 clients from myself and the other trainers that are teaching my program all over the world, we found that if clients did all 4 steps of the program, that within 6 weeks, they could make their diastasis 55% smaller. So that's all on the website in terms of the size of the diastasis, the condition of the connective tissue, all of that. The other thing that's very important about my program, just besides treating diastasis for women, men, and children, and pregnant women and new moms, also my program is very, very important to be using before and after abdominal surgery. So one of the side effects of diastasis is an umbilical hernia. Because the connective tissue is so weak, there's no support for the umbilicus. So once you strengthen the connective tissue, we have seen people's belly button go from an outie to an innie.
Hmm.
Okay, so before any kind of abdominal surgery, no matter what surgery it is, it's important to make the diastasis smaller because all the surgery happens on that connective tissue. That's where they cut in. All right. So if you make the diastasis smaller, there's little need for mesh, and we all know that the horrors that come with mesh.
Yep.
The connective tissue is going to be stronger to hold the sutures better. And most important is that the patient, because there's no real preparation for abdominal surgery. So if the patient strengthens their transverse, strengthens the connective tissue before the abdominal surgery, and with just 3 weeks before abdominal surgery, they can be really successful. They will know how to use their abdominal muscles in the recovery process to maintain the integrity of the sutures. Because when you look at incisional hernias, which is when you have abdominal surgery and the stitches come undone, all right? And what do the doctors tell you? I had surgery, abdominal surgery, a year ago, January. And after the surgery, the doctor said to me, "Now don't lift anything over 10 pounds." I said, "Doctor, every time I stand up, I'm lifting 127 pounds. But you don't have to worry because before I stand up, I'm going to engage my transverse, my strength and transverse, so I don't put any force on the stitches." So he looked at me kind of like, "Oh, well, that's a good idea," you know. I just met with 8 hernia surgeons. There was a hernia conference in Chicago, and I met with 8 hernia doctors, and we were talking about doing a research study because there is no research on patient preparation before abdominal surgery. So even if you work with the patient right away afterwards, that would be beneficial. But most beneficial would be having the patient like 3 weeks before surgery do the program so that they have those benefits and they would know how to use the abdominals afterwards. So my program is really important for this as well. I've spoken at a couple of hernia conferences and get many referrals from hernia doctors. So I'm very happy about that, that it's beginning to um, become accepted that this is a way to prepare patients for abdominal surgery, just besides making their diastasis smaller for the benefits of, because the side effects, when the muscles are separated, there's no support for the front, the back, the top, and the bottom of your body.
Sure.
Okay? So people end up with back and hip pain, GI disorders like constipation because the organs are out of alignment, bloating after eating, the umbilical hernias I mentioned, pelvic floor issues because there's a co-contraction between the abdominals and the pelvic floor. And I just read an article by a physical therapist talking about the effect on men on their pelvic floor with having erectile dysfunction from having large diastasis, which was very interesting to me. Um, so there's a lot of side effects with diastasis that people don't even realize because the muscles are here instead of here. And I used to say, there's no, limit. You can do my program at any point in time. There's no, people say, is it too late? Well, I've changed my mind on that because I worked with a doctor. I'm in New York, and I worked with a doctor on the Upper East Side who had a patient with a severe diastasis, but this patient was rounded over with the big belly. And once the back is rounded over, because I have to have the back in neutral spine to be able to do the program, to be able to engage the transverse, and for them to wear the splint and stuff. And that's sadly where it goes. The larger it gets, that's where it goes with the posture.
Sure. Because they don't have the strength to hold themselves up all day.
Yeah, right. It's. I was at a party. There were 30 people at the party, and when people found out what I did, I became the entertainment for the party, and I checked everybody there for a diastasis, and I was really the only one that didn't have it. And there were men, women, young children. Everybody had it, you know. And when we're checking the distance between the muscles and the condition of the connective tissue. We're checking for 2 things. So there was one 18-year-old girl there that was a big concern for me because she had horrific back pain. Horrific. 18 years old. She was bone thin, all right? horrible back pain, had been to every doctor, chiropractor, acupuncturist, anybody that dealt with back pain. She went to them, and not one person had checked her for a diastasis. Not one. When I checked her, I had to use two hands and spread my fingers to feel the ridges of her muscles. Okay? As a child, she had done gymnastics. She was a swimmer. She did tennis. She did all the things that make the diastasis bigger. She did crunches. So not one person had checked her, and this is such a concern for me, because uh, there's so many problems that people can have, and they just go from doctor to doctor, and it's never resolved. They put this girl on antidepressants. That was their solution for her because they couldn't find anything wrong with her.
Sure. So before we keep going, just to give people an idea, kind of describe what it is you're looking at. So when I initially think of diastasis, in our office, we take care of a decent amount of pregnant ladies. So there is that. Yeah, we can talk about that more. But for all the old guys with low back pain, every single one of them have it. I mean, I cannot think of one that does not.
They
So
all have, they all have it.
yeah, and when I think of it, I think of basically the pooching out of their rectus abdominal muscles, and it looks like instead of if they're doing a crunch, instead of the abdominal muscles actually crunching in and concaving in towards the spine, it's actually just poofing out.
Right.
Or it'll poof out and create almost like a dome.
That,
Is
that
what it
that's
is.
that's the doming. If they have that doming, you can guarantee that they have over a 10-finger diastasis.
Oof, golly, that is wild. So
It's,
just
it's
just so
and
everyone knows,
what happens is when people check for diastasis, they have them bring their head and shoulders up, so then the muscles come together. So when you lift the head and the shoulders, you're checking it at its smallest, not at its largest. They need to be down and putting your hands in here, right?
sure,
And if they have the doming, then I check on each side of I put 8 fingers in, I check on each side of the umbilicus. I check at the umbilicus, halfway between the sternum and the umbilicus above the belly button, and halfway between the belly button and the pubic bone below the belly button. So we go like this, and then we tell them now, if somebody's coming to you like this, they're going to immediately tighten. So you have to have them, and when they tighten, comes together. So you have them first relax there and you put your fingers in there, just relax it. And then you say, bring your belly button to the spine. And then the recti moves in closer. So you have to have them do this so that you can see when they engage it, belly button to the spine, all right, it comes in and then you have to follow it out so that you can see where it is at its largest. Now it's not an exact science. Basically we do check for the distance and the condition of the connective tissue. How deep do my fingers go? The deeper my fingers go, the weaker the connective tissue. If I feel a pulsing, I know that connective tissue is really weak. But the other thing that we do is we check the circumference of the body in three places: under the ribs, under the breast, here at on the ribs, at the waist, and usually people don't have a waist with the diastasis; they've straight down. When they
sure,
start doing my program, it goes in. So where the waist should be, and then over the belly button, all with the abdominal muscles relaxed. So we check the circumference because as the muscles come together, the circumference gets less. So that's really something that the patient can see. God, that they can see that because it's more difficult, to check for the diastasis and know is this correct or not correct. And then we also take the photos from the front and the side, and that was probably one of the best decisions I ever made because then our clients can actually see the changes, like of their belly button, and and getting a waist and the belly going down. So yeah,
that's
yeah, it's important to, but if you see the doming, you know right away. You know. If they
oh,
have an outy belly button, you know the same thing.
sure. And just to unpack a couple things because you unloaded there, which is great.
I
Uh,
what?
I said you unloaded information just now. I just want to go over a couple things because on this show we listened, or sorry, we listen. There are plenty of parents that are concerned, who are about to have children or they're aiming to be pregnant, who want to have a natural birth. More and more women want to have more of a natural birth. They don't want to be sectioned, let alone they don't want to be using medication and all that good stuff, which is a whole nother topic. So, is there anything else that you can say about this condition and in pregnancy? Because you hit the nail on the head. Women are about to do the hardest thing in their life, yet they don't. There's no training for it. The training is take your multi with folate and let's buy stuff for the nursery. There isn't anything, and oftentimes they're told that maybe exercise, maybe not exercise, let alone maintain any sort of core musculature strength.
Right. Well, having worked with pregnant women, the first 20 years of my career, I work with pregnant and new moms. I've been at births, uh, so pregnant women were my specialty for a long time. And and of course, eating correctly is important, of course. But my program needs to be practiced during pregnancy, so then it's second nature in labor. All right. So I always say to my pregnant ladies, who are you thinking about when you're having a bowel movement? I hope you're thinking about me because I get a lot of job satisfaction knowing that you're thinking about me, this precious moment in time. And they laugh because they think it's sort of funny that I would be saying that I'm getting job satisfaction, but they need to be practicing this skill of pushing with their abdominals, relaxing the pelvic floor, having the diastasis be smaller so that they can push effectively and not have a C-section. So, and then I teach a diastasis safe workout for pregnant women. So, and the diastasis safe workout is so that you don't undo the gains that you've made with making it smaller.
Sure.
And then to continue making it smaller into, and then to, once it's closed, to keep it closed. So it's important, the big picture with it. It's we're developing this awareness and the strength of this innermost abdominal muscle called the transverse muscle. And it's the only muscle that wraps around the whole body. It starts in the back, on each side of the spine, from the bottom six ribs to the top of the pelvis, and then it comes around to the front. And if you cut the muscle in half, the top goes behind the recti and the bottom goes in front. All right. So it's really connected to this outermost abdominal muscle. And nobody ever really strengthens transverse. All right. In my program, we strengthen transverse in a seated position first for 3 weeks. And then in week 4, we, you know, uh, we can start a back line, the head lift. There's no crunches because it's physically impossible to engage this innermost muscle, which is connected to the outermost muscle, when in a backline position when the shoulders are off the floor. It's just impossible because when the shoulders are off the floor, the spine is rounded. And if you just sit and put your hand on your belly and round your spine and then try and engage the abdominals, it's virtually impossible to do that. If you go into neutral spine and do it, you're able to do this. If you arch your back, you're not able to engage it either. So we have to keep people in neutral spine where they're able to engage this transverse muscle. If they're not able to engage it, then the muscle's moving in the wrong direction, forward, and it's bringing the connective tissue with it, stretching it. And if you keep on stretching it, you're not going to be able to strengthen it. The whole point is to strengthen this stretched out connective tissue. So, did I answer your question there? I
100%.
got,
And
I got up on a little tangent there.
love it. And what I'll kind of end that with is something I'm not necessarily hearing more and more. I don't feel like I can say that. I've only been practicing going on 13 years. But what I hear a decent amount with women who come in postpartum, because they like us to check their kiddos, is they'll say, I pushed and I pushed and I pushed and nothing happened. And what I'm hearing is if we have diastasis, that's going to be a huge part of pushing during labor and not being able to get the baby out.
Abs- Absolutely. Because if the muscles are separated 4 fingers apart or more, the muscles move side to side. The muscles have to be close together to push in that sagittal plane of movement front to back. Okay?
And
How am
we're
I going to
talking,
push front to back if the muscles are moving side to side?
and we're talking about, what everyone wants to call the 8 pack or the 6 pack, the washboard abs in the front. If there's a separation between the two that are most on the inside, on the medial side of your abdomen, that's what we're talking about.
Right. That connective tissue in between. It
Yes,
needs to be more rope-like instead of saran wrap-like.
sure. Then anything else you got to say about everyone with low back pain? Because if there's something we hound in the office is everyone and their mother can use more core strength. But this goes down to some of these people will come in with pretty bad doming, or what the old what one even gentleman called today. He goes, I got my pooch. I'm like, you got more than a pooch, man. This is an abdomen that's out of shape.
Yeah. My program is 4 steps, and I mentioned, that it's the splinting of the abdominal muscles, doing the exercises, developing transverse muscle awareness, and getting up and getting down correctly. So, if a client, I had a client, I just checked her for the diastasis, and she got up this way. She got up straight up. It's called a jackknife. And I made her lay back down again and I checked her. And basically, by doing that forward force, because it's physically impossible, if you come straight up, it's physically impossible to engage the transverse. All right. That's why you always have to engage transverse before you move, because you use your abdominals with every move you make and with every breath you take. That's why we teach belly breathing too. But before you move, so if you have a patient on the table, and they're in a backlying position, and you help them come straight up, okay, that is not good. So this client opened up her diastole. We were almost had closed it, and she had opened it up with one jackknife. Okay,
Yeah.
so getting up and getting down is really important. And when I used to do vocational rehabilitation with back injury patients many years ago, the first thing they taught in back school was rolling to the side. So it's very important, and what we ask, when you're examining patients, to is for them to engage belly button to the spine, keeping the head down, rolling to the side, and then getting up using their arms. All right, and getting down the same way from a sideline position. Once the head touches, then they roll on their back. To get up and down correctly, to go from a seated to standing position, but on the table, when they're being examined, not to jackknife them up. It's very important, to now, with my program, which can be done remotely, during COVID, what I discovered, because I was home anyway, I have an online support program which comes with all of our packages. And this and people always ask me, how long does it take to close it? Now, it's I can't give one answer because everybody's diastasis is different. The condition of their connective tissue, it's all different, and it's depending upon the severity of their diastasis, and doing all 4 steps of the program. Sometimes people will just do wear the splint and think that that's enough. That's just repositioning, but you have to do the little isometric exercises, because that creates this microcurrent. I thought it was blood flow initially, but then I read Dr. Helene Langevand's research on connective tissue, and these isometric exercises create this microcurrent in the connective tissue, and that's what remodels it and heals it. So you have to do the exercises, and then you have to use this movement that we do in the exercises when doing activities of daily living. When you sneeze, when you cough, when you stand up, when you sit down, you need to engage this muscle so it's going backwards. You don't want it going forwards because that stretches the connective tissue. So, um, so basically, my online support program progresses over 18 weeks, but and your diastasis is going to be smaller in 18 weeks than it was in week one, but I can't guarantee it's going to be closed because I don't know what you're starting with and I don't know what you're doing with the program. So there's no expiration date on my online support program because I don't know how long it's going to take. So people know that they can, if they have family issues and have to take up, they can always come back. As part of the online support program, I was doing a monthly webinar uh, to answer questions. And during COVID, I thought, well, let me just do it weekly. Okay, so I started doing it weekly, and it was so much more effective. So now I've continued to do a live webinar each week. And if our clients can't attend the live webinar, which is on Fridays at noon Eastern Standard Time, if they can't attend, then they can email their questions in and I'll answer them on the webinar and they can watch the recording, which is on the online support program, which has weekly videos. And so we do, want to support our clients however we can. If they have issues with wearing the splint, they can send in a video and we can help them out with that as well. So um, the program can be done remotely. Uh,
Awesome. Well, let's get into what's the information on the program because I'm sure everyone's dying to get that information. We'll have it in the show notes and in links and all of that good stuff. Uh,
so
but where can everyone find you?
So my website, you can do tuplertechnique.com, julietupler.com. You can do diastasisrehab.com. And on the homepage of my website is an intro program, and it's an hour video giving you everything that you need to know about what's entailed in the program so that you can decide if you want to do it. Goes through all 4 steps of the program. It shows you how to put the splint on. It goes through everything so that you know this is what the program is about. And then if you have any questions, and what we recommend is that when people sign up for the intro program, when they're watching the video, to write down any questions that they have, because once a month I do a live webinar on the second Monday of every month, which is coming up next Monday. I do a live webinar to answer anybody's questions that they have about their diastasis and about the program after they've watched the video.
Awesome. And now this might seem like an obvious question, but for those that are listening that are thinking, I don't know if I have it or not, I don't really feel like going and getting checked, but it sounds like this is right up my alley or my wife's alley or my husband's alley, or it's probably time to have this worked on because I'm pregnant now. Is there any wrongdoing in that?
Um, if you're pregnant, more than likely, in my experience of over 30 years, I would say 95%, not maybe 98% of the women have a diastasis. Now, the
Jeez.
size of it varies. The condition of the connective tissue varies, but I would say that most people, if somebody has an outie belly button, they definitely have it. Okay. Um, if they're having back pain, they should be checked for it. If they're having bloating after eating, they should be checked for it.
Got it.
So as I said, at that party, everybody had a diastasis. The 18-year-old, hers was like the biggest. She had never been pregnant. Um, and again, if you have abdominal surgery, more than likely that you have it. If you've been in a car accident, that force has sometimes caused the muscles to separate. So it's always a good idea to check yourself to see if you have it.
And that and just to kind of reiterate, like that 18-year-old, someone you would think who is fairly healthy, that means that that individual was at 8 fingers, you said?
I said over 10 fingers.
Over 10 fingers of
Uh-huh.
separation of
Yeah.
their rectus
So this
abdominal
is
muscles.
where I had to put both hands in, and in my pinky fingers, I could feel the ridges of her muscles. And it was all connective tissue here.
Yeah, separate. So that amount of space between her rectus abdominal muscles and an 18-year-old who was, uh, was it, was she 100 pounds, 120 pounds? Was she,
She might have been 110 pounds tops.
can you, I can't even imagine over 10 fingers of separation in anyone who's 110 pounds tops. That's almost grotesque. That's wild.
Yeah, she was bone thin, but her muscles were, and horrific back pain, horrific back pain.
I mean, that practically means that her rectus abdomini were on her lateral edges.
That's right. They were. That's right.
Golly, that is that is just
It's
wild.
yeah. It was very sad for me to see that they had her on antidepressants because not one person checked her for a diastasis. So I am thrilled to know that you're looking at this diastasis, and and I'm hoping more chiropractors do that. And um, I train medical and fitness professionals all over the world. I've trained since 2009. I've trained about 90. Some are on my website, some are not, because they just want it for their practice. And so the training is pretty intensive. It's a 8-week home study, and then 3 days either remotely or in New York. Uh, so a lot of times people don't have the time to do this. So I was thinking, how am I going to get it out more? And I came up with this doctor co-management program. And basically, what that is, it's with the chiropractor or the hernia doctor or the midwife, whatever the medical professional is, that they check the patient for the diastasis. They find out the patient has a diastasis. And this is a program specially set up for the medical professionals. Okay. And it's basically the medical professional checks for the diastasis, does the measurements for the splint, and basically the beginning information that we need, and then the patient is given to us, all right, and we have a medical only nurses or physical therapists they will be trained by, and they're seen weeks one is 2 hours. The second session, starting in week 4, is 90 minutes, and then in week 6 is 90 minutes, and then there's 4 little 30-minute checks. In week 6 of the program, um, the intake sheet is sent to the medical professional, and that medical professional signs off on it, um, and um, and then a co-management fee is given because they are working with us with this patient. And then the same thing happens in week 18 of the program. So basically, we work together. You get all the initial information, and then you just consult in the intake notes in week 6 and week 18. So that's basically how it works, and there's no insurance involved. So and the program is HIPAA compliant. So do you have any other questions about it?
No, I guess other than for all any just lay person, Jane Doe, John Doe wanting it, they can go to your website and learn more about the program there. And then for the same for the healthcare professionals that want to be able to either learn to take care of it because I need to get refreshed, and it's going to be well, I say that like I know what I'm doing. I don't. Most of the time this just comes with I see it, and I don't necessarily being fully transparent. It's not that I even follow up and check, is it even improving? When I see that, I'm thinking to myself, we have to do core strengthening, and I'm focusing on specific abdominal exercises that I find strengthen the core and help the back pain, but I don't do post measurements. So you got my mind spinning there. But anyway, I want to be able to just make sure that your website has all the places to go for healthcare professionals, lay people, all that
It
good stuff.
does. It has the place for professionals, so you can, um, contact us through there if you want to do the training or you want to do the doctor co-management program, because the doctor co-management program is sort of like it's a special program and it includes all the products and lots of support. It's sort of like the concierge program.
Cool. Cool. Well, all right. Well, I guess is there anything else that you have to say about this? This has been fantastic. I think it's gonna be a great show where everyone's gonna get a lot out of it because
I hope so, because diastasis has been ignored by the medical professionals. It's just been ignored. And, when people check, um, they're either putting their fingers in wrong and having the people come up, so they're checking it at smallest. So it would be nice to have people check for diastasis and then check correctly, and then just understand that the side effects that they're having maybe because their muscles are separated.
well, and it's just huge because you're talking about the fundamentals of proper core strength, and from there, you even alluded to posture.
And
Everything changes from it.
And you cannot have core strength unless the muscles are close together. Period. End of story. So if people are doing planks in an abdominal facing down position, that's stretching the connective tissue. Okay, so that wouldn't be a good idea if you have a diastasis. So any abdominal facing down, so instead of doing it this way, we'll do those exercises standing. We modify. As I said, it's really important once they strengthen the transverse muscle. All right, in week 6, we start our diastasis safe workout, because then they have strength of the transverse muscle, so they can use that transverse muscle with every repetition of every exercise. It's sort of like patting your head and rubbing your belly, but it's really the best way to work out, where with every repetition on the work part of the repetition, all right, I'm engaging my abdominals. All right, so all the power is coming from your now strengthened core, which is close together.
Absolutely. All right. Well, it's been a pleasure having you on, and
Thank you so much. I really appreciate it. Anytime I get an opportunity to talk about it, I'm thrilled.
it's been great. My wife, Dr. Lauren, who I work with, was like, "Well, do you think that this is going to be like a good topic?" I was like, "This is going to be massive. It's going to be massive." And she's like, "Oh, yeah, of course, duh." She wasn't like thinking about all of the ramifications.
That's the issue all the time.
Yep.
Is that exactly how your wife felt is exactly the issue that I have.
Well, it's just been lovely, and thank you again for coming on. And if the program changes or you got more info that comes out and you want to come back on, just let us know.
I certainly will.
All right. Thank you.
Thank you.